Hey, good morning. I'm Dr. Steve Stites, Chief Medical Officer here at the University of Kansas Health System. This is Show Me the Science. Cancer treatment can change a patient's appearance, and some patients lose their hair. Their skin might change, and surgery might remove part of their body, like a mastectomy. Today, we're talking about how these changes impact a patient's self-esteem and why healthcare can't ignore this important step in a cancer journey. There's a lot of science around this, and we know that these studies have connected changes to the body and a cancer patient's mental health. There's also evidence that patients feel better when they get counseling, support, and a personalized care plan. This study, published in JAMA Surgery, surveyed 560 women diagnosed with breast cancer before the age of 40. Some patients had one breast removed, some had both. Other patients had surgery that only removed the tumor and preserved most of the breast. This multi-center cross-sectional study, which means it was done in lots of places, and they looked at patients in all sorts of circumstances, found patients who had double mastectomies, that is, both breast removed, reported the worst impacts on their body image and their mental health. Probably not a surprise. But patients who had a surgery that preserved a breast reported a better quality of life. Another study published in Psycho-Oncology analyzed 36 other studies on cancer-related hair loss. It found that cancer patients consistently rank hair loss as one of the most distressing side effects of therapy. It also found that wearing a hat, headscarf, wig was one of the most important coping strategies. And you think, this sounds really obvious, that of course if you have a bilateral mastectomy or you lose your hair, that's going to have a bad impact on your body image and frankly how your recovery goes. For so much of what we talk about in this program, we talk about therapy, vaccination, science. But today, we're going to meet two people who help cancer patients cope with the changes to their body. Lizzie Wright is a social worker and a program director at Turning Point. We're going to talk about what Turning Point does in just a moment. Good morning, Lizzie. Good to have you here on the program.
Thank you.
We also have Judy Newell, the Appearance Center Manager. Now, Appearance Center sounds like something you'd see on a television show, but the reality is it's an important part of cancer therapy recovery. And she's going to join us live today from Missy's Boutique, another great resource for patients here at the cancer program or at the health and at the health system. Good morning, Judy.
Good morning.
Nice to have you here with us today. So just to say, we do talk a lot about drug therapy. Today, we're going to talk about mental health therapy because we know how much someone's physical appearance affects their mental recovery from something like cancer therapy. So Lizzie, talk to us a little bit about what Turning Point offers patients, maybe not even just cancer patients, but really all patients.
You're right, not just cancer patients. So we're a department of the health system, and we have been around since 2001, but became a health system department in 2012. And our specialty is offering patient and support programs, educational programs for people who are living with a physical illness and their supporters.
Yeah, that's a big deal because you guys are taking folks who are going through a lot of stress in this world and trying to help them make a mental recovery, which is going to really aid their complete recovery.
That's right.
So what do you see, what differences do you see in patients who go through some of your programs? How do they come in and how do they leave?
So they come in with incredible fear and anxiety and uncertainty after getting this significant diagnosis. And we have studied our programs, and we've seen that our programs reduce depression and anxiety at a significant level. And really we see an ease after they're taking our programs, after having connection with other people who are having that shared experience of going through cancer treatment and surgeries. So just relief that they're feeling that they're being heard. Our programs are run by a licensed facilitator, and they're able to help them express their thoughts and feelings and emotion, and really an improvement in their physical well-being.
You know, I think this has really got to be difficult for a woman who loses both breasts, either because of a genetic process, like they're BRCA1 or 2 positive, and they've lost their breast because of the fear of developing cancer, or obviously in patients who have cancer and have to think, not only do I have cancer, but now I don't have my breast. And what is that? You have scars left, and what does that do to someone's mental health?
Sure. You know, it changes your whole life. A cancer diagnosis changes your life in an instant, and that is how people come to Turning Point. You know, they're feeling lost, they're feeling hopelessness, and they're wanting to connect with other people who have had a similar experience like that, and that's what we do, is bring them together. But yes, it can be a terribly emotional time, isolation. So that's what we try to do, is meet people where they're at and provide programs for them that can help be a support and help them work through all of those emotions that are a normal part of the cancer treatment experience, unfortunately.
It can be really hard. Well, talk to us a little bit about your work with Missy's Boutique. How do they fit into that recovery plan?
Yeah, so Missy's has been a part of our program offerings for the last few years, and we do that in partnership with Gilda's Club, another great cancer support organization in town. So quarterly on Zoom, Missy and the great folks over at Missy's Boutique, or Judy and the folks at Missy's Boutique, offer educational programs on wigs, wig care, breast forms, breast prostheses, and bras to help women throughout their cancer treatment. So we offer that via Zoom, and it's a great, wonderful asset to our programs when folks want just more information from a specialist like Judy.
So let's talk with Judy over at Missy's Boutique now. The boutique is over at the University of Kansas Cancer Center in Westwood. Judy, the boutique is named after two women, including one of your relatives. Who were the Missys?
I'm more than happy to tell you about the Missys, Dr. Stites. As you can see, the pictures are behind us. Here, this is my daughter-in-law, Missy Malter Newell, and this is Missy Wilcox O'Neill. Both women we lost many years ago to breast cancer. And at that time, they had to go to many different places to get the items they needed, like bras, hats, gowns, compression garments. Everything was a different place to go. So their dying wish was to create a place where women like them could go and do one-stop shopping. And thank goodness Kansas Health Systems came along, and with them and with the families, we was able to raise the amount of money needed to create this beautiful facility for all our patients in all communities.
Yeah, that's really great, and I love the story about the founders there. So what do you offer a patient who's dealing with hair loss? Show us some of the cool looks there.
Yes, okay, let's go and visit into our wig room, and let me show you what we can do. There's a lot of magic that goes on in this boutique. Okay, first of all, each one of these doors are filled with wigs. And if you noticed out in the front, we had wigs from short to long. That lets our patients know that we have any size or any length of wig they want. Then we have hundreds of color swatches here, and we can definitely give them the color they want. The crazy thing is, we decided to bring in something a little bit fun and funky, which was a lavender wig, just for fun. That's our #1 selling wig now. So these ladies want to have some fun. It's a chance to step across the line for a while. But we have a wiggery lady in here, Sarah. She was just awarded one of the best wig fitters in Kansas City. So anybody that comes here will learn about the care of wigs, the caps, the fibers, and anything else in between.
That is pretty cool. I love the lavender color. What about textures? I know African American women, Caucasian women, Hispanic, Latinx. I mean, all have a little different texture. Do we have that kind of flexibility too?
There is no problem here. Every person of every culture or color can be taken care of here, and we're very, very proud of that. And we have wigs that we can show them for what they want. This is a working together with the patient to make them happy and to find exactly what they're looking for. And Sarah can do that in here. She nails it every time.
That's impressive. So for someone like me who's also lost or is losing his hair, what do you think about a lavender look? How would that work?
Hey, to each their own.
Well,
This is that time to be a little brave.
All right, you help with some prosthetics as well. Let's take a look at your prosthetic fitting room and some of the things you're doing for women who've had mastectomies.
Oh, sure. I have to say, too, the wig room is the most emotional room because that's the beginning, most generally, of the journey. When they come in here, it sounds crazy, but we have a lot of fun.
I can see
And
that.
I set some things out.
Hard.
Yes, I set some things out so you can see we have a huge variety of a little of everything. We have prosthetics of tawny or ivory. We have nipples that we can put on. We have bras with pockets. And I have to tell you, this is like going to any department store. Our bras are seasonal. So we have our spring line and our summer line. And so it turns over all the time. So we are on the edge of everything in here. We know what's happening in the community and with fashion.
I think that looks really amazing because I know women after mastectomy, they have to wait for at least 6 weeks before they can think about having those type of bras fitted. Is that about right?
Yeah, it's 4 to 6 weeks. The drains have to be out. Some women are doing so well, they just want to get back to work. So we have things that will take care of them on that part of their journey. But our thing is to give back their self-esteem. We understand in here what they're going through. Most of us are breast cancer patients, so right away there is a sisterhood and we connect. And I know that we're doing good because, let me show you, we have these nice little satisfaction surveys that tell us we're doing good, and we get the most wonderful compliments on these surveys and even quotes. So I think we're doing amazing, and
I bet you do.
And I'm happy to say we have 5 fitters now, which is incredible for a small place. We rotate.
That's awesome. So now you've talked about some of the things you sell in the boutique. What about Mother's Day is coming up? Anything special deal, anything to consider for Mother's Day?
Absolutely, and as you can see, as we're passing through to the Mother's Day items, we have everything. This place here was created to make our patients feel like they're in a regular department store. There's nothing more a woman likes to do than shop, and we have that here.
All right, so
as we're moving forward,
go ahead.
No, as we're moving forward here, you can see some of the wigs that I talked about. You can see the hats that we have. And now we're going to go up here to Mother's Day. And we don't want to forget about Nurses Day also, because Mother's Day and Nurses Day are in the same month, not that far apart. So in the front here, we showcase our nurses' items. And then now we have all of our Mother's Day items here. And there's not a lot left because we have had shoppers.
Well, that's awesome. So now one of the big questions I have are, what are the hours at Missy's Boutique?
Okay, we open from 9 to 4. We take our first patient at 9 and our last patient at 4. And we allow an hour for each patient. We have 2 rooms going at once, which I'm so happy that came about last year because we've gotten so busy. And so we're here to not let anybody get away because we want to help them.
I love that. That's awesome. Okay, so now, Judy, what has been like partnering over with Lizzie at Turning Point?
Well, I tell you, since that came about, it's been absolutely amazing because with those two organizations, they have helped me reach out into our community and touch women that don't even know items exist for them, whether they're bilateral, unilateral, lumpectomy, whatever. They simply don't know about it. And you touched on it in the very beginning, and I thank you for that, Dr. Stites, because sometimes we are forgotten, but we are part of that patient's journey. It's really important for us to help them bring back their self-esteem, their confidence, and be able to laugh again and feel like they used to. And so we're asking all of our doctors and nurses here and on the outside, please tell your patients about what we can offer them.
You know, that's a big deal, and Judy, to be honest with you, it's our honor to be able to talk about this because we spend a lot of time focusing on physical health recovery. We're talking about mental health recovery here, which is incredibly vital in the battle against cancer. Lindsay, used to working in oncology, why is it important to foster hope with cancer patients, kind of like what we do right here?
Oh goodness, it's important. You know, one of our facilitator talks about hope and how it's the bridge between present and future, and I love that analogy because I think that really meets cancer patients where they're at. And usually they, like we said, are dealing with uncertainty and fear and anxiety and depression when they get this diagnosis. And we all need hope, and especially someone who's living with a life-threatening illness. So hope is, you know, the idea that things are going to get better. And that's important when you're in the midst of that and having, you know, it's just a really emotional time for patients.
It is an emotional time, and I think we've talked a lot on this program about the intersection of faith, hope, and science and the importance of that. Once again, I thank Vissy's Boutique and the work you guys are doing at Turning Point. I think it helps demonstrate the importance of hope in recovery and in perseverance. Those are big things. So, and now I think with the COVID pandemic easing, but there are a few things left behind from COVID, like telehealth. Impact to Turning Point?
Yes, that's really been a positive impact to us. Initially it was difficult, like everyone was moving to Zoom programs, but we have been able to reach more people now with the Zoom program. So we have patients out in rural Kansas and even out of state who attend our programs. And it makes sense for our population. They might not be feeling up to traveling to our physical location to take programs due to treatment, or maybe they're immune suppressed and they shouldn't be traveling. So it's really opened up a lot of doors for us. Yeah,
big darn deal. All right, if you have questions, please send those in to us on YouTube, Facebook, Twitter, or email. The links are right there on your screen. We're going to check in with Doc Hawk today for the COVID count.
Yeah.
Hawk, I noticed earlier in the week it kind of bumped up a little.
Yeah, you know, we were hoping to get down to those single digits. Unfortunately, it did increase on Monday. It's come down just a little bit. 32 total, but 42 active, and 2 in the ICU, none on the ventilator.
32. Did you mean 22 active?
Sorry, 32 total, 14 active.
14, there you go.
Of those 14,
you spooked me there for a minute. I'm like, whoa, I didn't look at that.
Of those 14, 2 severe with 2 in the ICU.
Yeah, that's tough. And I just want to say, we haven't seen quite the respite this year, and I think probably that's a result of masks coming off, and yet most people have their own innate resistance because of they've had COVID, plus obviously the incredibly important role of vaccination too.
Yeah, exactly. And again, I think there's just more circulation now overall compared to a couple of years ago. And we know that, you know, some people are just getting it and may not be testing. So maybe still out spreading it, even though they're still supposed to be home in isolation for those 5 days and then wearing a mask for those 5 days after that. So there could be just some of that continued indolent spread going on as well.
Yeah, it's a big darn deal. So the COVID-19 public health emergency officially ends on May the 11th. That's right around the corner. And this week the White House announced it will no longer require vaccinations for federal employees or international travelers. What do you think?
Yeah. You know, I think with all of the data that we have taken in, we certainly know those people that are at highest risk of disease are maintaining their up-to-date status with those booster vaccines as they are recommended. We remember the FDA did put forth some new recommendations a week or two ago as well. I think that is also coupled with continued people who've been vaccinated and infected and reinfected, developing some of that individual immunity, and then that playing out is to this population immunity. But I think the important thing for that is it doesn't mean that the pandemic is over. What that means is there will be a reduction in some of these funding avenues, as well as access to certain things as well, and that includes vaccination, although certainly we know that insurance companies should still be paying for those vaccines, but it's more of a financial issue and access to things.
I think that overall, we've lived through the worst portion of the pandemic. Mm-hmm. Is it still a pandemic? Is it endemic? I think those are words. The reality is that SARS-CoV-2 continues to mutate and change. It will continue to be here and we are going to continue to have it be a communicable disease. And I think we're going to have to be vigilant, because the challenge to us is, because it can mutate so fast, that it may mutate into something more severe or less recognized by our immune systems. We just have to be on guard against that. Mm-hmm. I think everybody's tired of hearing about it, but it's still true that that could happen. In the meantime, vaccination continues to work and reduce the risk of death and the risk of hospitalization. Thoughts?
Yeah, no, I totally agree. And as we have said before, this disease is really becoming a disease of those that are most at risk, those with, at certain age groups, as well as those that are immunosuppressed. And so while the pandemic is over for a lot of people in their day-to-day goings on, we have to remember and can't be myopic and understand that there still are large groups of people who can be very at risk from the effects of COVID-19, at risk of hospitalization, severe disease. So I think we need to continue to talk about it and understand about the virus, just as you said, if new variants pop up. Right now, all of the variants that have been out recently are all lineages of that original Omicron. They do not seem to be any more severe. But we know that if you are immunosuppressed or have older age, you certainly are at risk. So it is vitally important to get tested early and to get on that oral antiviral Paxlovid. That has a significant effect in reducing your chance of hospitalization and severe disease. And of course, staying up to date with the boosters as recommended. But also, Dr. Stites, as you say, those pillars of public health go with you wherever you are. It is always okay to wear a mask. That will help reduce your chance of getting infected, but also important to be vigilant in hand hygiene as well, and understanding those situations that you may be going into that may put you at higher risk.
The rules and pillars of infection prevention and control travel with you wherever you are, even into this moment, and they do help keep you safe. Alexis Del Cid has questions, I think, coming in from the community today. Alexis, welcome.
Good morning, Dr. Stites. Such a great discussion. We have a question from Paula, and this is one that we've seen a few times come across our chat feed. Paula wants to know, will insurance pay for wigs and other items at Missy's Boutique?
All right, what's the word about
yes.
payment? Yeah.
Yes, they will.
Yes. Most insurance companies will pay for wigs. The only company that does not pay for wigs, unfortunately, is Medicare. But I suggest every patient to contact their insurance company to see exactly what amount they will pay and how often they can receive the items.
Oh, that's good.
Good
that's
advice. And we need to work on Medicare. Patients should be contacting their congressman as well, and I'll tell them, hey, let's get that point about Medicare fixed. Way too important for mental health. Yeah.
Terry has a question. Terry wants to know if Turning Point works with other support groups outside the health system.
We do, yes. We have, so the back page of our calendar has a list of all the support groups. A lot are affiliated with the health system, but some of them are not. So yes, please contact us. And also wanted to point out, you do not have to have any affiliation with the health system to take programs with Turning Point. We serve the entire community as long as you're living with a physical illness or a supporter of someone with an illness.
And really, Turning Point is there to help with that mental recovery for anyone. You don't have to be a health system patient. Right. You don't have to live in Kansas City. I mean, you guys support people from all over, and the work is truly remarkable. You'll find a lot of folks who have benefited from Turning Point.
Thank you.
Actually, Gene just wrote a nice comment. He's one of our viewers. Gene writes, Turning Point is a great organization. So many people really value Turning Point. And then Kathy wrote in, she just wants everyone here to know what a great program it is and how helpful it's been. And I have a question coming in from Orlando. Orlando has a good question. Orlando wants to know, what about the emotional well-being of a patient's family members? Is there anything for them?
Yes, so family members, and we count that as friends and family too. So anybody that's a primary supporter of the person living with an illness can take our programs. There are some specific, like we have a Supporting the Supporters group that meets weekly, is run by one of our clinical social workers. So there's some groups just for them, but they can also benefit from any of our programs, meditation, mindfulness, our body movement programs as well.
Corey has a good question. Corey wants to know if you need to make an appointment to come in to get fitted for a wig, or if you can just show up.
Yes, great question. Everyone needs an appointment. The best way to do that is to call our support service line, which is 913-588-0130, and please don't forget to hit option 2. And they'll be glad to take care of you and get you in to see us.
And if you just call the Cancer Center, I bet they can help find you all, Judy. And in addition, is there a way to schedule online?
No, not at this time. There is not. We're working on a lot of different things in here, and that's something on our wish list.
All right, we'll make sure we gotta remember to get that done. Okay.
I have a question. Oh. I want to know, how do you find your wig fitter? You talked about you have the best wig fitter in all of the whole state. How did you find Sarah, your wig fitter?
That's a long story. Before my life here in Missy's, she worked for me, and she was like 17 years old. So then she opened up her own salon, and I went knocking about 12 years ago and brought her here. And so I knew Sarah, I knew her passion, and I know how good she does her job. And so we're blessed to have her here.
Yeah,
I would like to have another one.
Oh, I think she's advertising. I think Judy's recruiting. That's what I'm hearing.
Nice.
I do, yes.
All right. Any other questions today, Alexis?
Just people writing in saying they love the program and they're so grateful for Missy's.
They are grateful for Missy's and grateful for Turning Point both, I think. So I want to get some final thoughts from our guests. Lizzie, what do you want folks to know today?
Just to reach out to us. We're here, even if you don't think you need support, you might need it down the road, or maybe a family member needs it. So I would just put that out there to call us, email us. We have an easy online registration system. Healthcare staff can refer to us via the medical record as well. So several ways to get to us.
All right. Judy, final thoughts for today.
Yes, I have a couple. First of all, I want everybody to know in Misty's we help give back symmetry and balance, and help take that patient to a new norm. Also, I wanted to remind everybody about our class, or my class, coming up June the 20th. And this will be a class on overall product. So please, you can register at Turning Point or at Gilta House. And so one final thing, this is the big item in here I forgot to show you. This is our shirt for ports. The doctors and the nurses over here at Westwood absolutely love these products. Thank you very much for what you've done and what you brought to the forefront today, Dr. Stites.
Well, we have a great team that does that work. You know, I'm just kind of the talking head over here, and these guys do all the work. So you guys are remarkable. A couple of comments for you in just a moment, but Hawk, final thoughts.
Yeah, just these great organizations. It's always good to hear about that and what they do for the patients and their families and friends, just as we heard. And we know there's a lot of questions about the ending of the pandemic emergency per se that is coming up, and we will keep you informed of all the newest data still based on vaccines, vaccine recommendations and updates, and of course any new variants that are out there as well.
All right, thanks to this team. I just want to say, cancer has touched my family's life many times, unfortunately, and I just wanted to say thanks to you guys for the great work that you do, both in our community and with individual patients. I just can't say enough of the good things here for both Mrs. Batik and for Turning Point, and for anyone from any healthcare. This isn't only about KU. This is really about the community support that's out there that people will need when they go through times like this. So thank you for that. We mentioned that cancer touches all of our lives and how thankful and appreciative we are. And we've also heard today about how strong and how much people appreciate this program. One of the key folks in this program is Bob Hallinan. Bob is one of the folks behind the screen. He doesn't get to be on camera very often. But we're mourning with Bob the loss of his wife of 43 years. Bob Hallinan and his wife Jean have been mentioned, as I mentioned, we're married for 43 years. Jean passed earlier this week. Bob, I wanted you to know that all of us here, we are all thinking about you and your family. It takes a family. It takes a family to get through loss. It takes a family to get through cancer. Remember that Mrs. Batik and Turning Point, they're part of the family. So with that, I want to just say, remember, throughout our program, not only thank you to our guests, but thanks for everyone watching. Remember that faith, hope, and science are the way we can survive a lot of things, and we can get through those things together. We weave them together, and they're very much stronger than any of us are as individuals. Just like Turning Point and Mrs. Batik, and are part of the woven fabric of recovery when you're battling cancer. Thank you all. We'll see you back tomorrow. We'll have this teaser just to help you get ready for that.
Coming up tomorrow on the Morning Medical Update. One woman lost both of her parents to COVID in a matter of days. It broke her heart, but COVID wasn't done with her. I'm Jessica Lovell on the next Morning Medical Update. You know our guest if you watch our updates. The disease that claimed her parents now has a hold on her heart and her health. The full story Thursday at 8 a.m.
I'm Alexis Del Cid. On the next All Things Heart.
We were in the kitchen talking, just a regular conversation, laughing, and all of a sudden, I couldn't speak.
The married doctors now facing a health scare, the strange symptom and the diagnosis that had their worlds colliding, and her husband's unique connection to the surgery, Thursday morning at 10 a.m.
Subscribe to our Morning Medical Update and Open Mics with Dr. Stites podcasts. Now, everywhere podcasts are available.